Well, welcome back to our 5 questions, 5 answers series, and thank you so much for being a part of it. This week I'm interviewing Melissa Hall, Chief Executive Officer of Susan B. Allen Memorial Hospital. I chose to interview Melissa because she's able to view our county in a unique way. Her insight and knowledge of various health-related topics like mental, physical, and emergency care are integral for our community. So, Melissa, if you will just tell us a little bit about yourself and the role that your organization plays in our community.
Sure. So I am actually a nurse, is what started my healthcare journey. And so I've actually worked in almost every field of nursing that most hospitals have to offer. Some of the specialty stuff, not so much. But and so through that progression, and then went into some leadership. And so what I get to bring to the table, and then from more of an operations perspective, is I truly can speak from not only the administrative side, but the clinical side of things. So being a bedside nurse, you truly get to see how decisions and orders and those types of things that are happening to our patients affect them and their families. So I think that's a really unique way to get to sit at the table and make some decisions, so that I can see them from every angle, and we can, as a team, make the best decision for all.
I love that because I feel like and maybe it's more present nowadays, I'm not sure because I'm not in the industry, but I feel like a lot of times there's that disconnect between administration, or at least higher administration, and patients and staff. So I'm glad to hear that you're passionate about making that connection and maybe making it easier.
Yes.
So I love to hear that. Can you maybe talk about the goals that the hospital has in 2024?
Sure. So one of our biggest focuses is we just want to get back to good quality care. So we have some of the very best staff. I honestly have worked in several hospitals, and I don't say this just because I'm the CEO here. I really do genuinely see our staff that are, either in El Dorado specifically, in Butler County, throughout the community. We have some that commute quite a ways to get here, but they truly care about our patients. And I really just want to show the community that that's what we have to offer here. And the other big focus for us is we're just trying to rebuild some relationships. So we have some local physicians that are not employees of SBA, but we're all one team, right? So for our community, all of the healthcare teams have to be headed in the same direction. So everything from our local physicians, EMS, the health department, we all have to we're all one team. We're all trying to serve the same group of people, the same patient care population. So that's really one of my biggest focuses, is just to get us back together and all headed in the same direction of just offering great quality care to our patients.
I love that. It's a great first step.
Thank you.
Especially, when did you join the team here?
So I actually started with SBA 2.5 years ago, but as the operations officer, and then I just took over the CEO role in August of this last year, 2023.
Awesome. Well, congratulations.
Well, thank you.
Yeah. All right, so thanks so much for speaking with us today.
Absolutely.
Our goal with the Butler County Times-Gazette this year is to understand our role in the community better than ever, and so that's why we're doing this series. So this is our opportunity to ask the same 5 questions to individual community leaders just like you across Butler County. So again, we chose you because you can give us a perspective of the entire county, and we're looking for different perspectives that it'll bring to our project. So we'll move on with our first question.
Perfect.
Okay. So what are the most pressing challenges facing our community at a local level right now?
So in the healthcare world, and this is not unique specifically to Susan B. Allen Memorial Hospital, but our reimbursements are getting cut from everything from Medicare, Medicaid, even the commercial payers don't pay as much as they used to pay for the same type of work. But unfortunately, our costs are also going up. So drastically increased during and after COVID, but even before that, things were changing as supplies cost more, those types of things. This is one of the few businesses, and I don't think a lot of people know this, but healthcare is one of the few businesses, regardless of what I charge or what it costs me, my reimbursement is set by an insurance company. We're only going to pay the hospital a set amount for that service that we're providing, regardless of what the materials or the staffing or any of that cost. So that goes into it. But so I think that again, that's not unique to Susan B. Allen, but that definitely makes a very big impact when we are a smaller community hospital. We just don't have the layers and layers of resources that your bigger hospitals have. And volume is a significant thing for us. So if right now, one of our specific to Susan B. Allen is we don't have a lot, we do have a lot of community that support us, but some of our community members choose to go to Wichita to get, maybe their total knee done or something like that, where we do have orthopedics here, and if they would choose us, those are things that would help us from a financial perspective also. So I think sometimes it's a matter of maybe we haven't done the best job of sharing what all we can do, but we need the community to utilize our services not just in the emergency, right? Not just in the time that we're having the critical moment and we need the ER right now, but we need the community to use us for if you need an x-ray or if you need lab work done. Maybe you need a sleep machine, so let us help you.
Definitely.
Yeah.
So has the hospital done anything to address that challenge? Or those two challenges, I guess.
Sure. So I'll be truthful, in 2023, so I took over in August, and one of the biggest focuses that I helped to get our team collectively, internally, is just to get re-engaged with the community. So, we really put an actual effort to becoming a part of this community and whatever options that we had available to us. For example, there's an opioid task force, so we joined that task force so that we could then have a voice and offer to them what we have from an educational perspective. We have a unique setting to give patients information and an outlet to do that if we know what's available. The local police chief actually created a resource committee group that truly it is all the local communities of, rather that's the Butler Homeless Initiative, it's mental health, it's the health department's at the table, we're at the table, and that's truly a time for us to come together and talk about how do we help these individuals that just need a little bit more. So if we're discharging them from the hospital, what resources can we offer them right here in the community? Really trying to take a focus of just reestablishing those community partners. One of the other things that we did was we partnered with Holly Frontier Sinclair and did a wellness clinic for them. So those are things that we're just trying to rebuild that, and hopefully we'll regain that trust, or maybe at least be able to tell people what we have to offer. So maybe if they get the order for an x-ray, they'll think, oh, I should go to Susan B. Allen to get that done.
I love that. Okay. We'll move on to our second question.
Okay.
And that is, considering the evolving media landscape, what role do you see local newspapers playing in the community 5 years from now?
Yeah, so, I think when you think newspaper, and to me anyways, I'm still old enough that it's a physical newspaper. Those days are probably few and far between. There's a few of us that still like to read a paper, but for the most part, I think we have to be comfortable with a digital outlet, right? So no more of just the sit down, you ask me questions, I answer them, you print them.
Right.
It's the video, it's those types of things, and I think as a business we have to be comfortable to be transparent with some of those things. So yeah, I think we still need the media to help us be a voice. I think a lot of organizations, public and private, rely a lot on Facebook and those types of social media outlets, but for the most part, if people want factual information and they want the truth of things versus maybe just someone's opinion, they still go to the paper and those types of avenues to find that information.
Definitely. We try to be a one-stop source for that and try to take in as much news as we can and get it straight from the source, obviously, and try to incorporate video with this initiative. And we have our paper in PDF form online on our website as well. So we definitely try to evolve as well. Are there any emerging trends that you think local newspapers should embrace?
Yeah, I think just from a community perspective, I think just an awareness of what is actually still available and here. I think most places do a good job of promoting if you have a new business, or I know the chamber does things in conjunction with you guys if a new business has a ribbon cutting and all of those things, which are great, but sometimes if you've been around for a while, people kind of forget. And maybe they haven't had to use your service, so they don't really know what all you have to do. So from a paper perspective, I'd love to see just more of what does El Dorado have to offer? What does Butler County have to offer?
Sure.
Yeah.
Okay, I'll keep that in mind. Third question, in your opinion, what role should our newspaper play in promoting civic participation and community involvement?
So I think just making people aware that they're even happening. So especially, like city council meetings, like if we know what those topics are gonna be, then that way maybe we wanna be more involved in those. Or maybe even giving an outlet for us to voice some thoughts, concerns, those types of things. From a nonprofit perspective as the hospital, I would love to see just things that maybe we're striving to improve. So for example, I know I get some patient complaints in regards to how our billing structure happens and what those statements look like, and they're hard to read, and maybe they're hard to understand. And so maybe it's let's dive into that. Let the hospital help you understand your bill, or however that works. Or maybe, and from our perspective, honestly, that's one of the things we did do. We've actually changed our statements and how that whole process is working, and so maybe that's an avenue we could share that through the paper so that people would know, oh, they're listening to me.
For sure, yeah. Fourth question is, what community events or activities do you believe our newspaper should cover to better connect with our residents?
I think anything that will bring our community together. I think, so I have a high school student, and so I feel like by nature you're involved, you get to see people. My son specifically is into athletics, so I meet lots of people. I have opportunities to collaborate with people and talk with people just in those settings. But from outside of that, I don't really know of a lot of things that go on that just bring the community together so that people can talk and discuss, and I didn't even know that was an issue, or those types of things.
Yeah. Are there any specific events that you feel need more community support?
So I'm probably in a little bit of a unique situation because I actually commuted the first year that I worked here, and so we just moved here this last summer.
Oh, cool.
And so I'll be truthful, it was actually hard for me to know what even was going on. So for example, like I saw roadblock barriers, and I'm like, what's going on? And they're like, oh, we're having a parade. I'm like, okay, what's it for? Those types of things. And I think even just truly even knowing that the paper would have that information to offer to me. Again, I think sometimes we rely so much on social media, but I've found some of that's real delayed, or I don't see it on social media until like the night before or the day of, or we've already missed it.
Yeah, and that's kind of something I'm navigating, because social media algorithms are very interesting, and they're very specific to the person, and so if you don't visit the newspaper's page a lot, it will not show to you what I'm posting.
Right.
So I'm trying to navigate a good way to send people to the website or to visit the Facebook page more often, or just engage more that way, so you guys can get notifications or something like that.
Yeah.
But yeah, it is hard to navigate that, because even I visit them all, or try to keep up with things.
Sure.
And it'll be like an event that happened yesterday, and I'm like, that would have been a great event to attend and take pictures of.
Right, yes.
But it flew by for some reason, and for whatever reason, I'm just now seeing it. It's kind of weird.
Yes, and that's, so I kind of hate to rely just on social media avenues just because of that, but I'm very much, I like people, I like to interact with people. My kids kind of joke, I drag them to all kinds of things, because I'm like, we gotta see what's going on.
Yeah.
But if you don't know till after it happens, it's kind of hard to get there.
Do you think a community calendar could be beneficial, where we have that on our website and it just shows everything happening?
Yes.
Yeah?
I think that would be great.
Okay.
Yes, I think that.
Number 5 of the 5 questions will be considering the current economic landscape. How can our newspaper support local businesses and contribute, or the hospital, and contribute to economic growth in the community?
So, I know I feel like I've said this a couple times now, but truly just knowing what, as a hospital specifically, what services we have to offer are truly going to be that piece of the puzzle. If we don't have the local support, that's what keeps our doors open, right? So without it, and then any community, once you've had a hospital, if you don't have a hospital, it's very detrimental to a community from many avenues. But yes, we're close to Wichita, but you're still not close enough that if you're having a heart attack, you don't want to have to wait clear to Wichita to get help. Right?
Residents in Latham and Leon and Cassidy and
absolutely
Potwin all rely on you as well.
Yeah.
And Douglas probably as well.
Yeah. So I think it's vital that we are here and we are a cornerstone of the community, and whatever that takes, right? So I'll be the first to tell you, one of the first things that I did in this role was I am available. So I've met with various community members that just share, hey, I used to come here all the time. It's not that the quality of care isn't great. It's not, it's just either I ended up getting transported to somewhere else, and so then I just started going there, or maybe it was some billing issues that we had, or maybe one event caused them to maybe question what they were doing. And so I challenge anyone, if you have that feedback, I can't fix everything overnight, but we truly do want to address the things that are, if there's barriers for people coming here, we do want to know what they are, and we want to address them. Because from a staff perspective, I cannot say this enough. Our staff, all the way around, is truly committed to the patients that they serve. So
I love that, and I can tell too with people that I meet that work here. And like I said, my sister works here, and she talks about her coworkers all the time and just how much they love it, and they love their patients, and they love the community.
Yeah.
So I think it shines through.
So we really truly are trying to make changes to make that show all the way around.
Yeah. Okay, well, thank you.
Yeah.
Thank you for being part of our 5 questions, 5 answers. That was our last question, but we will ask just one more.
Okay.
And this one's easy though. What question can we ask the community in our upcoming survey that your organization would like to know the answer to?
Oh, gosh, I don't know that that's that easy. What value and what importance do you see that the hospital brings to this community?
I like that. Okay, so Melissa, you heard Melissa. She wants to know what value the hospital brings to you. Okay, and that's it for this week's interview. You can catch us next week as we interview a different sector in the community, and you can please help us spread this conversation and let us know what you thought about today's interview. You can share this video, let us know what you think, and just start the conversation on our Facebook page or on YouTube. Thank you.